A new emergency procedure in the hands of first responders in Howe.
K10's Aiden Joe Ferris takes a closer look on what they can do.
Howe Fire Rescue and EMS are making strides in emergency care, becoming the first department in Grayson County to be trained and ready to perform life-saving thoracostomies.
This was first brought to my attention a few months ago by the guys and girls that work for us. They were looking at ideas and ways to further advance our treatment.
With more people starting to call Howe home, the procedure went from an option to a necessity.
There has been some close calls that we have needed this before, but we ended up doing other life-saving measures and saving the patients.
So what exactly does a thoracostomy look like? Howe Fire Rescue and EMS volunteers told me that it all starts with a scalpel on the rib cage.
We actually go down to the 5th rib. We'll go on top of the rib here, make our cut through the skin, through the subcutaneous tissue, about a 2 to 3 inch cut. Come down, we'll spread this open.
This procedure involves inserting a tube to drain air or fluid in the area between the lungs and the chest wall.
We'll shove our finger in there, swoop around, and then we have a really big hole to allow air or blood to come out. It's a 10 gauge IV catheter, so we'll stick that in through the chest wall, remove this needle, and that will be inside the chest cavity to relieve air and or blood.
This move could mean the difference between life and death.
Any kind of major traumatic event, any kind of major car accident, any kind of cardiac arrest, things like that that we need to get air and blood drained would be what we use this for.
Going forward, Howe Fire and EMS volunteers will train annually at UT Southwestern in Dallas to stay up to date with the procedure. In Howe, Texas, Aiden Joe Ferris, K10 News.